Hi, welcome to Natural Health Radio. I'm your host, Dr. Teresa Dale, and we are on Facebook Live as well. So tune in and, I want to hear from everyone. I want to hear what your questions are. We want to communicate about what's happening related to your health. This is your Health Freedom Network. This is your health freedom education. And one of the things we're going to bring up today is pharmaceutical drugs related to depression, related to anxiety. Are you on any of these meds? Okay, this is very, very important. Or do you know someone who is on any of these meds? There's things you need to be aware of. You know, one of those things, and the most important thing, is they can cause death by suicide. So you're taking a drug for depression. You're not feeling good. You're not feeling happy. Take a drug for depression and it can cause suicide. So we want to make sure that you're aware that this is a fact, it's truth, and you can see this yourself if you're watching TV and you see one of the ads come up for these medications. You'll notice that people in the ads look very happy, they're smiling, and while that's happening, they're giving you the bad news. They're giving you the news that this drug can be fatal. Okay, that means suicide. That means death. You need to start telling people who are on these prescription drugs that there is an epidemic of people on these drugs and an epidemic of people committing suicide and death and dying from them. So we want to talk about that, but I also want to give you solutions to meds that are used for suicide. So we want to give you solutions. It's not just about giving you the bad news. It's about giving you what the facts are, teaching you how to press the mute button when you hear one of those things come up, those infomercials about, are you depressed? Are you sad? Do you have anxiety? That should be your cue. Push the mute button, because unfortunately it can get into the subliminal consciousness. And you get to hear the name of a drug long enough, and something happens and you go to your doctor and that name may pop up. Unconsciously, you just may say it. What about this or what about that? Here's the facts. The facts, the alarming, bare naked facts, are that medications that are used for depression and anxiety can be and are, in many cases, reported fatal. That means you commit suicide. That means there's death. So I want to give you solutions as to what to do instead of that, but I want you to think of anyone you know that you can help, that you can reach out to. Take this information down and pass it along. It's not a secret. You just have to read the product information, the product supplement that comes with the product that tells you that you can commit suicide. It can have fatal results. So why take anything that can be fatal when you can take things that work, that can be happy and wonderful and help you and do it quickly? There's a whole protocol I'm going to give you. So get your paper out, make notes, and help people. That's the key. We want to pay it forward. Okay? So these medications, these prescription drugs that are given by doctors, psychiatrists, regular doctors, okay, even general practitioners, anything that is an antidepressant, any one of them has a indication on it and a side effect of being fatal, any one of them. So even if you're taking them occasionally, you need to be aware that this situation could happen to you, even if you're taking them occasionally. So we do want to have options. That's what we're about at Health Freedom News here, Natural Health Radio. That's why I'm bringing it to you on Facebook Live. We need to have options. So, and that's what I'm here to give you. So get a piece of paper. We'll write down options that you can do instead of taking the fatal prescription drugs for depression and anxiety. All right? So the first thing is we want to enhance your circulatory system to get some vitamins up to your brain, to get some nutrients there, and also to work with homeopathy. But the first thing I would do, which is proven to work with depression, by the way, is something very simple you could get. It's called niacinamide. B3, vitamin B3, will enhance your circulation in your brain, in your whole body, but also in your brain. It'll cross the blood-brain barrier, and it'll affect your neurons, and in a positive way. And it is used for depression. Vitamin B3, niacinamide. If you were depressed, you could take with food 3 of them, 2 of them. Just depends on the quality. You want to get good quality niacinamide without any preservatives, coloring, magnesium stearate, flow agents, anything like that. So you just want to go to Dr. Dale's wellnessstore.com and search for niacinamide up in the search bar. You could also put vitamin B as in boy 3. That is proven to work for depression, also helps stop smoking, also helps diabetes, helps many different things, but it's a winner for depression. And it's when you take it, you also need to take a homeopathic remedy to bring the neurotransmitters in your brain to balance, because when they're not in balance, that is when depression hits. Depression can be caused by many things, including the mercury in your mouth and a buildup of mercury. But niacinamide is a great thing for depression. It is researched for years, and you can read about that at Dr. Dale's wellnessstore.com. The other thing that is very important for depression is the NeuroBalance Pro, and that is used to balance neurotransmitters and also to help balance the amino acids. So NeuroBalance Pro is homeopathic. It's in a spray. You do 2 sprays 3 times a day. Non-toxic. If a baby took it, it wouldn't hurt them for the NeuroBalance Pro. Niacinamide, on the other hand, is used for adults and teenagers, and in a very tiny amount, it can be added to a smoothie of a child who is depressed chronically. Sometimes children don't tell you when they're depressed because they don't have the words, but you can see if they're crying all the time. I mean, it could be many different things, but let's say someone 9, 10 years old and up, you can work with niacinamide and the NeuroBalance Pro. That's 2 things right there. And there's more. So what we're talking about for many of you who are just tuning in is the antidepressants that people are taking and the reports that have come out on usage of those antidepressants and the side effects. And the key most important side effect for me to communicate is the fatality, is all of the suicides that have been documented. Imagine the ones that aren't documented from being on an antidepressant. Now, you don't want to give that to your loved ones or take it yourself. You want to find a solution, whether if you're depressed or have anxiety, and if you're using a prescription drug for depression or anxiety, then you need to talk with someone to lower the amount that you're taking and stop them, but not stop them all at once. Some of them may have serious side effects if you stop them all at once, but with those, you could take the niacinamide and NeuroBalance Pro and wean yourself off of it. Or you could see a health provider, but I can guarantee you that a medical doctor who would give you such a harmful prescription drug is careless. And I wouldn't trust that person to be able to know what to give you that will help you. And I'm sorry, I don't need to be negative, but someone who gives you a prescription drug for depression and anxiety, even if you asked for it, right, should be educating you about your choices. I know that's what you want. I know you want education. That's why you're on this radio show today, and I can see you on Facebook Live. Is you want to know about what to do for loved ones, for people you know, for yourself. You want to know what kind of vitamins are clean, where to buy them, what things are toxic in supplements, and even more about homeopathic medicine. So homeopathy is used for depression every day. It's been used for 200 years for depression and has zero side effects and will really, really help you quickly. It works quickly. So the reason I am talking about this today, another reason, is that I invented neuro-emotional remedies. That means that these are high-potency homeopathic remedies that handle depression, that handle anger, that are very specific for your needs. And you can do a free self-test on my website. It's wellnesscenter.net. That's wellnesscenter.net. Go up to the top bar and click on free self-tests, and you can take your own test for the neuroemotional remedies and find out which remedies of those you need. And this is very specific to you. So go there, fill that thing out, and then you will be able to see exactly what you need in homeopathic medicine. So the neuroemotional remedies are a high-potency homeopathic medicine that is approved by the FDA. Homeopathy has been around for 200 years without a side effect, so whatever you're feeling emotionally, you can get help with that. If you want more help, you can go to our members area, become a member, and you can email me once you're a member. But I'm telling you that the risk in taking pharmaceutical medication for depression is huge. You don't want to subject yourself to that, because before you know it, you're out of control in what you're doing. You never want to feel out of control unless it's, sometimes a positive thing can make you feel like, oh my God, I feel so happy. I don't know what to do next. Okay. That's where we want to get you. You want to be so happy that you don't know what to eat next and what store to go to next and what trail and hike to take next. You wake up in joy and bliss. That is what I want for you. That is what you can have. But you can't have that on a pharmaceutical drug that is supposed to be controlling your brain and isn't going to be doing that. I can guarantee you it is not going to be doing that for long. Because the toxicity of the drugs build up in your body. They build up. And then they create the toxicity, which is the negative side effects that happens. So instead of the high that you think you're going to get, which may last for a few days, up and then down and then up and then down, this is something you don't want to have in your life, right? So you are looking for alternatives. That's why you're there. You're looking for alternatives, things to heal your body so that you can have an expressive soul. The soul that you are is only positive. There's only positive there. But it's all being covered up by the medication, because the medication is supposed to control your mind, but there's no way it can do that. That's why we have fatalities from using prescription drugs. I mean, and after all, you can start using niacinamide, vitamin B3, and the dosages and the milligrams in my products are correct. And it tells you what to do and how much to take on the label, but you can do advanced research on that. And there's no flushing with niacinamide where there is with niacin. That's why niacinamide is safe, where there's no flushing. It's safe anyway. It can lower your blood pressure if you were on regular niacin. It can lower it too much, but we're not doing that. We're doing the safe form of niacinamide. It's called niacinamide, vitamin B3. That's what you want to take for depression, for diabetes, for your circulatory system. If a man has EDD, erectile dysfunction, niacinamide. It's good for the circulatory system, bypasses the blood-brain barrier, and helps you with depression, chronic fatigue, helps you with diabetes, so many different things. Read about it in drdaleswellnessstore.com. So we're talking about a list now. For depression, the neuroemotional remedy number 10, very specific, works on depression. But if your depression is coming from, if you can identify what it's coming from, if it's coming from anger, if it's coming from irritability, if it's coming from resentment, if it's coming from rejection, you can find out those specific things by going to wellnesscenter.net and looking at the top green index bar and then clicking on self-tests. Okay, and then you just scroll down to find the neuroemotional survey. You take that self-test and you'll see exactly what you need and which one of the 13 remedies or 2 of them or 3 of them you need in order to handle those issues that you have that are causing the depression. If they are emotional issues, can be handled. If you're depressed and you don't know why you're depressed because you have everything you need in life and you don't know why you're depressed, then could be mercury in your mouth. That for sure causes depression. It's researched to cause depression. So we have to understand there's always a reason why. And you can be in control of that. You have the power to do that. To give up your power to a doctor who's going to give you a drug, I mean, I don't even know what to say about that. You need to keep your power and become more educated. That is why you need to be here every Tuesday at 1 o'clock, because we will give you the latest thing that you can do, that we find out about from all of our different sources, to help you with all of these problems. And you may not be on medications yourself, but you may know a lot of people. You may know one key people. You may know a family member that is on these meds for depression or anxiety. Okay? And you might be able to save their life just by recommending a few simple things. I would do a slow cleanse. I would detox the heck out of your body. Okay? I would add the niacinamide to that, and I would find the neuroemotional remedy that is related to most of the emotions that you think you can, that you need to work with by filling out that neuroemotional remedy survey. And I would include the NeuroBalance Pro, which handles all neurotransmitters, homeopathic, no side effect, and that you can give to an autistic child. That you can give to a baby with no side effects, as well as the neuroemotional remedies. So anything homeopathic that has to do with depression, that has to do with feeling like you're so depressed that you can't handle it anymore, and so it drives a person to go to a doctor and ask for a med, okay? You can help that person or help yourself. So this show is about connecting with you and supporting you in keeping your power and helping others to do the same thing. When you help others to retain their power, you're going to help them heal their life, because when you give up your power is when you get into these difficult situations where you are so desperate that you go to a medical doctor and ask for a drug. Well, I want to say that that is totally unnecessary. You now have information you didn't have before, and you will know people or meet people that you can help on Facebook, LinkedIn, Twitter, in your family. Maybe even your doctor is on a medication and you could say, hey, I helped myself get off this drug. Maybe you can use it for yourself or your family. So we want to understand that everything is fixable without drugs. You just need to know what it is, what to use, and help to identify where these problems come from. So we know for a fact that mercury fillings causes depression big time. I remember 35, 40 years ago, maybe 40 years ago, I hate to say it was that long, but it was. And I went to naturopathic school in Germany. My first day, they said, do you have mercury fillings in your mouth? And I said, what's that? And they said, open your mouth. And they looked, and he said, almost every tooth has a mercury filling. We can't test you with electrodiagnosis or any testing method to find out what to give you or what you need until you get those out. So next time you come back to class in 2 months, have those out, or you can't come back to class. You can't be in this naturopathic training. So I went back to Texas, found a biological dentist, which they were called holistic dentists then, and had all the mercury removed. And I have to tell you that the depression that I had since childhood went away in 3-4 days. It was totally gone. And then I started doing a lot of research, and I saw that depression was caused, one of the things it's caused by is mercury fillings, because it's a battery in your mouth. You've got in one mercury filling, mercury, copper, tin, silver. It's an amalgam of metals that when they're put together in a filling creates a battering effect, and it affects your neurotransmitters. It leaches the mercury into your system and into your brain. Your teeth are in your mouth is in your head, and all of this stuff passes the blood-brain barrier and affects your neurology, causing depression. So that's the first thing. Check the mercury fillings. The second thing is look at what you're eating. Look at any vaccines that you've had in your lifetime, because they all affect people because of the mercury in vaccines and the aluminum in vaccines. So if we've had vaccines, we can detox them. When you become a member of our Wellness Optimization Club, which you can do on wellnesscenter.net, it's only $20 a month for your education. You will see a protocol for detoxifying vaccines. It's not on the retail website. It is in the members area. It's protocols there for healing that my members have access to. So think about that. Think about your education. This is only part of it. This is a start of it. Come every week at 1 o'clock. I'll give you everything I have. I'll give it to you. But if you want even more, then become a member, okay? That is why I created that membership for such an inexpensive price, so that you could really make a change in your life and pass it on to others. We have to know that depression is curable without drugs. Yes, that's right. Depression is totally curable without drugs. Okay? So it's curable with nutrition, with niacinamide, working with getting rid of your heavy metals in your mouth, the mercury fillings, and of course, working with homeopathy. Talk about proven research. Homeopathic medicine has been researched for 200 years to not have any side effects. And even most important is that it's proven to work for what I'm saying. What I'm telling you is proven. Now, these medications that you take, prescription medications, is not proven to be harmless. It's proven to be fatal. Okay, it's proven to cause fatalities. So being that you know that, why even risk it? Just use niacinamide, detoxify your body with the slow cleanse, and use NeuroBalance Pro to balance your neurotransmitters and the neuroemotional remedies. And do that neuroemotional remedies survey that's free for you on free self-tests at the top of the page of the wellnesscenter.net. You'll see it. So what else can you do? Well, I think it's really important to make sure that you're not getting toxicity from the supplements that you take. Many people that come to see me are having reactions just from the supplements they're taking because I test them. When they come to see me, they bring me bags of their supplements that they're taking, literally, maybe 50 products. And they say, this is what I'm taking to help me, and I feel awful, and I feel terrible. And as I just even look at those supplements with them and teach them, I show them this product has coloring in it. This product has magnesium stearate in it. This one has stearic acid. This one, the next one of them could have all of those things and worse, and sugar. Especially if it's a chewable, then it's going to have some sugar in it, unless it has stevia in it. For anything in a capsule is going to have some kind of a flow agent, or perhaps just it's in gelatin capsules. You don't want gelatin capsules. It's made from horses' hoofs. You do not need to have toxicity in your body if you are working on healing your body. That's how people get sick, is they have a toxin from this area, a toxin from that area. They have toxins from different things that they're eating or taking because you need more knowledge in order to navigate this life. If you are navigating this life, you need tools. And that's what we're providing you today, and what you can get from the members area of our wellness center. Once you become a member and you log in, you can email me. I don't care if it's every day. You can send me an email and ask me questions for no charge. So I encourage you to do that. All right? We want to know that you are having the best life possible, that you are having the most bliss, the most joy that you can possibly have in your life. And if you are not there, then there's things we can direct you to, point you to. And, as a human being, we're all human beings. Some days have highs, other ones have lows. But the idea is when you have a day that has a low, that you know what to do about it to change it. So you know how to shift it. If you feel like it's a low because yesterday you had so much sugar or you had a fight with somebody and it's just bothering you, you have to know how to fix it. That's what I will be helping you with, and I am helping you with today. You have a low, even if it's a little low that you don't like, niacinamide, NeuroBalance Pro, Neuroemotional Remedies. If you want to add a super supplement to that will also help your brain, use the Optimal Multi Pro because it's a nutraceutical, one of the few that is 100% clean, made in the United States, in veggie caps, no toxic flow agents. The only excipient itself is we use, and I use organic rice bran as a flow agent so the equipment, the machinery can blow the supplement into the capsule. Okay, so that's the only reason rice bran is used, but it's not a toxic supplement. Nothing toxic. It's organic. It's rice. So in the supplement, you've got everything real, pure, and clean, and it works immediately. You can even open it up and put it in a smoothie for a child. As an adult, you would want to take 2-3 times a day with meals, or 2 times a day with meals. It balances all your B vitamins. It has phosphatidylserine and choline from sunflower. Okay, it has just 5-methyl tetrahydrofolate, which is the best folate for for depression. It's the best, most expensive one, and then it has the most expensive, best form of B12, which is your methylcobalamin. So this keeps your body healthy, and this is an essential that you would do every day to work with your brain. It's called Optimal Multi Pro. Balances the body, keeps the brain balanced, and just imagine if you add that along with NeuroBalance Pro and the Neuroemotional Remedy that works, number 10, that works for depression, but you could need other ones depending upon if there's a lot of anger and rage, then you would need the Neuroemotional Remedy number 6 for anger and rage. You can find all of that out on Dr. Dale's Wellness Store if you go there and explore. So the niacinamide is very key. If a person is depressed, you could give them, depending, you could have somebody, they have to eat, and they could try 3 of them with a meal. And I doubt that anybody can be depressed after taking 3 of them with a meal. I think that's a lot. And then maybe they only need that once a day. 3 of them. It just depends on the severity, but slow cleanse, and I'm not saying everybody needs 3 a day. Don't go and do that, and then, whatever. I'm just saying that legally, I have to protect myself. Every person is different. Somebody could need 3 once a day with a meal. Somebody could need 1 once a day for the meal. Absolutely non-allergic product. We've never had anybody be allergic to any of these things or have side effects to any of these things. Our slow cleanse is an emergency if you're on any medication whatsoever to keep your body detoxified and clean, okay? Because it cleans out all of the filtering organs simultaneously. There are herbs that do different things. There are some herbs that work for both the kidneys and liver, but it's so non-specific that we don't handle the cysts and the polyps and the different things that have a tendency to be in kidneys rather than liver. So that's why we have different formulas that are part of the Slow Cleanse kit. So if you went and looked up every single ingredient in that Kidney Pro, you would see in Medscape that some of those important organic ingredients are used in other countries for cancer. You'll see that referenced. I can't put that on the label, but you'll see it when you look it up. It's the same for for the liver. So we want to detoxify, cleanse the blood, pull the poisons out gently, detoxify the liver, the kidneys, and the colon simultaneously, so they all get treated in a positive way at the same time. This puts no stress on any other organs when you do it this way. That's why some hospitals are choosing to use these products in their outpatient clinics to help patients get off the drugs. We need to understand that our healing is our choice. It's our health freedom. It's our choice. And we need to make that choice. We can do that. We have the tools to do that. Membership, Dr. Dale's Wellness Store, wellnesscenter.net. And I've given you the names of the products. Share this video several times if you can. The more you share it with the public, the better. Or your timeline, whatever you choose to do. Like it, share it. It will get it out to more people because there is a health emergency in the United States. It's called pharmaceutical drugs for depression. Pharmaceutical drugs that are antidepressants. They're also used sometimes for fatigue or lethargy. We have to understand that there's a way to do this naturally. That's what we do at Health Freedom here, right? At your Health Freedom show at Natural Health Radio. So as you know, I'm all about health freedom. We're going to be having some events coming up soon that are free to you. And in the future, we're going to be having some live events in different parts of the country so that I can meet you and help you and answer your questions and pull the lid off of all of these prescription drug issues and try to get to the bottom of what you're dealing with and give you tools that can help you, that you can leave with and start using right away. Simple things. Well, I think we're almost out of time, Daryl. We have 10 minutes. And in that 10 minutes, I want to talk to you about a story. And I was in Dallas. I was with a friend for the last few days, and she thought this story was really amazing. And I thought, this is something that happened to me. It didn't seem like an amazing story. It was just something that happened. But now in retrospect, I go back and look at it and think, oh my God, this maybe is an amazing story. So the first one is something I think that you can learn from right away. And that is when I was studying in Germany, Chernobyl blew up, but they didn't announce it for 2 weeks after it blew up. And I was in the south of France taking classes as a student, and I started feeling terrible. I was in Malaga, Spain, right on the beach. And all of a sudden, I just got the flu. I got the fever for no reason. And I thought, what is going on here? And other people were getting headaches and not feeling so well. So after that training session was over with in 2 weeks, I traveled back to Germany to go to my teachers who were doctors and said, can you test me and find out what's happening? I have a flu or something. And they tested me and they go, no, you don't have influenzainum. You have radiation poisoning. And they looked at me and they go, where could this come from? Where have you been? What have you been doing, Dr. Dale? And I said, nothing. I mean, I've just been studying and this happened. And so it was a big puzzle to us until a week later. France, Germany, and the entire Europe announced that Chernobyl in Russia blew up 2 weeks ago, and everybody was being radiated, and there were people dying from it. There are still fatalities from cancer from the people who were close to it or experienced this. So I had to figure out how to cure myself of radiation poisoning, which I never did before. And so I asked the doctor, what do you think? And he said, well, use homeopathic cesium, use homeopathic uranium, use homeopathic plutonium, get them in different potencies, and, use all of these things. And so I was taking about 20 different homeopathic remedies a day to get rid of the radiation in my body. And slowly I started to feel good and better. But I had to leave Europe and go back to the United States because it was all over. And so then I went to my family in Switzerland, and it was the only newscast in Europe that actually told people the truth. Every 15 minutes, they announced how many rads were on the ground, how many rads had reached the Alps, how many rads were in different cities and counties of Zurich and Geneva and different places in Switzerland. So they had equipment counting the rads. And then they told the population, don't drink milk before a certain or after a certain date. And they told them, don't eat any vegetables in the supermarket. Don't eat any cheese from these dates. They actually protect their citizens and had them not drink tap water. So they were coming on every 15 minutes and alerting people as to what to do. This is a country that has always protected their citizens. Other countries there didn't have that because I was there. And they told us exactly what to eat, how to detoxify. It was amazing. And one of the most important things you can know about Switzerland and France and Germany, for that matter, is that when you go to the hospital there for any reason, you will get homeopathic medicine to treat your condition. And at least in some states, you'll have a choice. And so what I'm saying is I cured myself of radiation poisoning. And that was a key thing in my life. Okay. The other thing is that when I was 22 and a half, I had a tumor on top of my uterus. I didn't have any information. I knew nothing about anything health-wise. I was eating hot dogs, hamburgers, smoking other people's cigarettes. I was just a mess related to my diet. And so the doctor said to me, you have a uterine tumor and we want to do surgery. And I said, no, thank you. And he said, why? I said, my mother had 9 surgeries. I watched her growing up. I watched the pain. I watched her on Valium. I watched her on Darvocet. I watched her change into the type of person that was suicidal. I watched her change to be an unloving, mean person just because of the meds that she was on. And all of the surgeries that she had needlessly, like they gave her a hysterectomy because she didn't want to have children. Okay? So She had a plastic part of her kidney. She had her gallbladder taken out. She had all of these different surgeries, and the only human being I've ever heard of that has had their coccyx bone sawed off. So having all of that information, taking it to the doctor, and him saying to me, I want to do surgery, I said, no way. He said, what are you going to do? I said, I'm going to learn to fix it because I know I created it. And so because I created it, I'm going to fix it. So I went to a health food store, found a book by Paavo Airola called How to Get Well, probably not in print anymore, followed the strictest program for tumors. I didn't know if I had cancer or not because I didn't let them do a biopsy. I wanted nothing to do with that, as you can imagine. So I followed the program, changed my diet, stopped smoking, started thinking positive things, and just went about my life. I had no fear at all, just went about my life. I didn't even tell my parents this has happened because I didn't want them telling me that I had to do the same thing my mother did, right? Because I saw the result of that. So I ended up healing myself of the tumor in 6 months, went back to the doctor, got all clean, saw it, wasn't palpable, wasn't on an x-ray. So I figured, hey, this is great. Maybe I can help other people do the same thing. We're just about out of time. And those are only a couple of my stories, but those led to my being here with you today, giving you this information. And I'd love to hear about you. Become a member, communicate with me. So you have to know that for some people at 22 years old, it could be scary for someone to tell them that they have a tumor. But having the background that I had only with watching them destroy another human being, I knew that this was my opportunity to learn how to fix these issues. And it worked. It wasn't hard. I didn't take a lot of supplements. I took vitamin C, took a lot of vitamin C. That was the only supplement I think I took, but I changed my life, my diet, my mind, my feelings, and had no fear about it whatsoever, not even an ounce of fear. I just knew that this had to be the way that would work. So I want to thank you so much for tuning in today. Would love to know more about you, and please share this. Thank you so very much, and we'll be talking with you next week. I have a guest. Brother Benson is going to be on with me to share with you how to get a healthy business. Something a little bit different, but I think very important. So I want to thank you so much. Have a beautiful week. We'll see you next week. Bye for now.